Hello, it's Dr. Pat, and we have an axolotl here today that will be having surgery, and we'll take you along with his journey. This axolotl is in an induction chamber right now, so it's a small quantity of water. He is housed and cared for very appropriately. We're going to discuss why he's having surgery, but first I think we should discuss basic axolotl care. It's very important with axolotls that you have a chiller and keep their water cool, and that's probably one of the most common problems I see with axolotls. Their water needs to be kept at about 60 to 68 degrees, and that is often not achievable without a chiller, and you should be measuring the water temperature. The other important thing is water quality. These guys can be pretty messy, and you should have 0 nitrates and ammonia in your water, and you should be testing it regularly. You can get little dipsticks, but it would be better to get a liquid reagent kit for the aquarium and test regularly. And then the nitrates can be very small amounts, but only small. And if we do that and don't put a rock substrate on the bottom, because they do eat rocks, I've had to take many of them out, in general, then you're doing some of the basics needed to try to prevent big problems. The other thing to consider is their diet. So many of them are fed inappropriately. They'll eat just about anything. In general, we recommend a balanced axolotl pellet and earthworms. I try to avoid feeder fish. They're often full of parasites and disease and will lead to more problems for your axolotl. All right, so let's get back to bubblegum. Bubblegum, when we look at him, so the first thing you do to assess their general health is to look at their skin. Axolotls are aquatic salamanders. That means they're amphibians, and they absorb through their skin. Their skin is very sensitive, and it's also an indicator of their general health. And so we look at the dorsal fin, and we make sure we don't have any erythema or redness or lesions on it. And then we look at the gills to make sure they have the branching. If they don't have that and they're starting to be stunted, that indicates a problem, often associated with water quality, but it can be associated with infectious disease as well. And then the body condition as well. So we want to make sure we're not undernourished or overnourished, which I see more commonly in axolotls. So looking at him, I'm sure you guys have spotted the problem, but we have a mass that's growing on the side here. So bubblegum started to have a little red spot that the owners noticed, and it has been growing substantially since they first saw this. And so the plan today is to surgically remove this. He will be anesthetized, and it's not quite as simple as a dog or cat anesthesia. So we anesthetize them typically through the water, and there are several agents that can be used. One is called MS-222, not as commonly used here as it is in Australia, but it can be used by many veterinarians. The other agents that are very commonly used in the US are alfaxolone and propofol immersions, as well as isoflurane gas in water in a sealed container. And all of those will be readily absorbed and provide anesthesia. Monitoring is very important, and we use Doppler ultrasonic probe for monitoring. We do meloxicam as an anti-inflammatory prior to procedure for pain control. They tend to not really have any appreciable effect with some of the narcotics that are routinely used in mammals. So we use the anti-inflammatory in a local, and we'll be going ahead and making an elliptical incision here, removing this mass and submitting it for histopathology. This could be an infectious mass or it could be cancer. And the only way we'll know for sure is to send it to a lab, have a pathologist look at this, and then go from there based on what the final diagnosis is. So keep watching, and we'll show you the procedure for bubblegum today.